You went online. You watched a couple of videos. You talked to a friend who has some information. You came away with a diagnosis. Putting a name to the feelings really brought a lot of relief. But the problem is, your behaviors haven't changed. You're still dealing with the same old things. Today, we're going to talk about why your diagnosis could be holding you back and what you can do to fix it. The DSM-5-TR is a manual that therapists use to diagnose mental health conditions. What it does is group patterns of behavior seen across time with people who have a specific type of diagnosis. It's not identifying the cause of your pain, it's just putting a name to the pattern. A diagnosis is just a starting point for your treatment planning. It is not an explanation of who you are. And here's what nobody really ever wants to tell you. A label is not a solution. Understanding why you do something is not the same as changing it. Now, let's look at a real-life scenario to see what this would actually look like. Think about somebody who spent their whole life struggling to focus, can't finish tasks, emotionally reactive, brain firing in all directions. They get evaluated and they walk out with an ADHD diagnosis and walk out with a prescription. For a while, ADHD feels like the answer, but the medication isn't really working, and something still feels off underneath. Here's what got missed. This person's trauma scores were through the roof. Memory problems, emotional reactivity, problems sleeping. These are all symptoms of ADHD. They're also symptoms of trauma. And the problem here is trauma and ADHD overlap significantly. A clinician saw the patterns, they diagnosed it accordingly, but they completely missed the cause entirely. This person needs to be doing trauma work with a specialized therapist that can help them work through their trauma. What they got was a prescription of stimulants. The diagnosis explained the behavior, but it didn't touch the root cause of why it was happening. Let's take another example. Let's take somebody who watched 3 hours of videos online while they were trying to determine what their mental health diagnosis was. By the end, they was able to identify the pattern in their behavior, and they came away with what they thought was an accurate diagnosis. But here's what happened next. Confirmation bias kicked in. They started confirming or noticing all of the behaviors that matched that pattern. Then they started noticing every behavior that matched the label. And they started excluding all the ones that don't. This person's diagnosis now starts to feel like their identity. It's who they are. Then someone comes along to challenge it. A therapist, a partner, a friend. And what happens? The defense mechanisms kick in. Denial, deflection, you name it. They'll say, "You just don't know what I'm going through." The label is no longer a tool for understanding patterns of behavior. It's become a wall between them and the work that they need to do for them to actually find change in their life. The diagnosis isn't wrong because the feelings aren't real. It's wrong because it stopped the right questions from being asked. Next, we're going to go over what you need to do to fix these issues. Step 1. Ask yourself why. Before you accept any diagnosis from a therapist or psychiatrist or a doctor even, ask yourself this one question. Why is this diagnosis important to me? If the answer is accommodations, documentation, or some sort of access to treatment, then this is a legitimate reason. If the answer is I want it to explain why I am the way I am, then the diagnosis may be working against you. A label that mostly brings short-term relief may be protecting or keeping you from the painful process that you need to go through for real healing. Because healing isn't comfortable, it requires you to go through it. You cannot avoid it or go around it if you want the behaviors to change. Step 2, get screened properly. What does this mean? As in the example above, trauma and ADHD have very similar symptoms when you look at them in a pattern of behavior. Before accepting a diagnosis from a professional or any other person, make sure that you're able to rule out any other issues that could be causing this pattern of behavior. Proper screening isn't just one questionnaire. It is a full clinical picture. Step 3, focus on behavior, not the label. You may not be able to change your diagnosis, and with many personality disorders, people suffer from those issues their whole life. But you can identify the specific behaviors that are causing you the most trouble in your life, whether it be through work, family, or in your individual life. This is where the real work lives. Being able to identify when you're being emotionally reactive or when you're falling into a pattern of bad behavior, and then being able to change that in real time. Putting a name to it through a diagnosis is the first step, but that's not where the real work lies. The real work lies in going through and facing all of these problems head on with a therapist and someone who can help you through your journey. The one key takeaway for today is a diagnosis is a tool, it is not an identity, and it is not an excuse. You don't go to therapy for comfort or confirmation. You go to therapy for change. And this is where the real work begins. If this video has given you a different way of seeing your diagnosis or being able to look at some of the problems that you're having, please leave a comment in the section below. I would be happy to respond and go over some of these with you. And tell me, has a label ever helped you or has it hurt you in your past? Please hit that like and subscribe button. It would really help me to grow the channel and would help me to continue making content like this so we can bring real truth to mental health. Thank you, and we'll see you on the next one.